Michigan Public Act 653, also known as Michigan's Minority Health Law, was enacted by the 93rd Legislature in 2006 and became effective in January 2007. This pivotal legislation mandates the Michigan Department of Health and Human Services, or MDHHS, to develop and implement a comprehensive structure to address racial and ethnic health disparities within the state. The Act's primary objective is to create a systematic and structured approach to achieving health equity. It requires MDHHS to establish a framework designed specifically to tackle these disparities. One of the key components of Public Act 653 is the requirement for annual reporting. Each year, MDHHS must produce a health equity report that is submitted to the legislature. This report documents the department's efforts to address racial and ethnic health disparities, providing updates on progress, highlighting areas where gaps remain, and outlining additional resources and actions needed to advance health equity. Public Act 653 emphasizes several critical focus areas. First, coalition building. The Act ensures the formation and maintenance of coalitions that support health equity initiatives. These coalitions play a crucial role in uniting various stakeholders and fostering collaborative efforts to address health disparities. Second, representation. The Act promotes the representation of healthcare providers who reflect the communities they serve. This is essential for building trust and ensuring culturally competent care. Third, data collection and analysis. The Act mandates the gathering and analysis of data to inform policies and practices aimed at reducing health disparities. Accurate and comprehensive data is vital for identifying issues and measuring progress. Fourth, training. The Act requires comprehensive training programs to educate healthcare providers and other stakeholders on health equity issues. Training is a key element in building awareness and capacity to address disparities effectively. Since its enactment, Public Act 653 has guided MDHHS in its efforts to reduce health disparities. The annual health equity reports have evolved to address current public health challenges, including the significant impact of COVID-19 on racial and ethnic minority populations. The reports document how funding received during the pandemic was utilized to address these disparities and highlight the need for sustainable funding mechanisms to continue these efforts post-pandemic. Despite the progress made, challenges remain. One of the major issues is the sustainability of health equity initiatives without substantial funding. Long-term planning and resource allocation are needed to ensure these efforts can continue effectively. Inclusivity is another critical challenge. Ensuring that voices from all communities, especially those historically underrepresented, are included in the health equity conversation and strategy development is crucial. Public Act 653 remains a cornerstone of Michigan's efforts to achieve health equity. It provides a structured approach to addressing health disparities, requiring annual reporting and focusing on key areas like coalition building, representation, data collection, and training. The ongoing efforts and adaptations in response to current events highlight the dynamic nature of this legislation in addressing health disparities in Michigan.